Okay. Welcome everyone to our SR lecture. We will be having a Loren Leclezio lecture. I will be handing over to Petrus de Vries, our globally well-known child and adolescent psychiatrist, to speak to us a bit about the Loren Leclezio, and then also to introduce our guest speaker for today, which is Sharon Kleintjes, and we'll be speaking on socially responsive research in intellectual disability. Thank you, Petrus.
Thank you, Fatima. We're gonna hand back to Fatima at the end for questions and discussion, and hopefully there'll be some time for people to do that. So I am very, very happy to do a very short introduction to this lecture, the kind of big annual lecture of the Social Responsiveness Committee that we call the Loren Leclezio Lecture. And here on the screen, you can see our lovely logo. And many people, in fact, increasingly people ask me, so who is or is Loren Leclezio, and what is the Loren Leclezio Lecture? So the lecture is an annual lecture as part of our Social Responsiveness Forum. And we invite somebody nationally or internationally to do a presentation that exemplifies the spirit of socially responsive and community-based participatory research. So that's the overarching theme of this lecture. And many of you will remember the person, Loren Leclezio, but many ask me. Loren was a mother and a wife and a businesswoman and somebody with strong views about the world and people. She left school before matric. She worked as a model. She put herself through UNISA, trained as a neuropsychologist, a developmental neuropsychologist, came to UCT and was a master's student here, passed with distinction, did an amazing PhD project, and was an author of 7 papers on tuberous sclerosis complex. And one of the striking things about Loren was she truly believed in the power of research to transform local communities. And so she really worked with local communities, both in South Africa and internationally, to understand the needs of local communities in order to make sure that the research we do truly is transformative. And that's something I will always remember and always have in my mind of Loren's spirit in terms of socially responsive research. She died in 2018 at the age of 36, leaving behind 2 young kids and a husband, all sorts of things. And she left a legacy of an incredible contribution in a very short period of time. And it was therefore in recognition of her work that we, as the Social Responsiveness Committee, decided to introduce this lecture. So the lecture remembers a person, but it really is a symbol of the importance of social and socially responsive research. And so here are some pictures of Loren. Here you can see her at different conferences over the years and different places and settings, and some of the many awards that she's won in her short academic career. And so the first lecture was that I gave in her memory in 2018. Then we had an educational psychologist, Marita de Jonge, from the Netherlands, do the next one. Then we had the wonderful Lebo Moletsane, who's a social scientist and very, very participatory researcher in KZN, do the next lecture. We had our own dean, Prof Lionel Green Thompson, do one. Then we had Liz Pelicano, who does socially or participatory research in the autism community, do the next lecture. We had in 2023 Prof Linda Tron, who does a lot of work working with on adolescent resilience in various low-resource communities around Africa. And last year we had Prof Anna Janssen, who specifically does very participatory research in rare diseases. So you can see we deliberately alternate South African and international speakers. And so it didn't take us a long time to think in 2025 who we could ask to deliver this year's Loren Leclezio lecture. And so it is lovely for me to introduce Professor Sharon Kleintjes, Many of you will know her very well. She, a little bit like Loren, is a person who's a mother, and I don't know if she's a businesswoman, is a clinical psychologist, has worked with government, has worked in the non-profit sector, has done all sorts of different kinds of things. And she's currently the Vera Grover Professor of Intellectual Disabilities in the Department of Psychiatry at the University of Cape Town. And the reason we decided to select Sharon for this series, she really works in and with the intellectual disability community, trying to understand the needs of people and trying to think, how can we do socially responsive and impactful research that will transform people's lives? So I'm going to stop sharing my little screen and hand over to Sharon. Sharon, we're delighted to have you do the Loren Leclezio lecture for 2025. And I'm going to invite you to share your screen.
Thank you, Petrus. It's listening to your story about Loren. It's sad, but also encouraging that she's made a mark on the literature and on communities. And I think that's really what it's all about. It's working to have publications, yes, but also to try and make a difference. So I see that in 2018, you did the first lecture, and I'm doing, after that, the 7th lecture. So this is 8 in total, but without you, I'm doing the 7th. And she published 7 papers. So even though she's not with us today, the inspiration of this lecture, which is one of the outputs of being social responsive, carries on that memory. So thank you for reminding us who and what Loren was all about. So I'm going to be talking about, let me see, can I share that? Hang on, wrong one, this one, share. Can you all see this?
Yeah, if you just go full screen.
Okay.
Perfect. Thank you.
Okay. So the topic today is social responsiveness, but I thought I would start by talking about what is socially responsive research. And the little definition I have up there speaks to all the dimensions of socially responsive research. It's about engaging with social issues and the power dynamics that impact on the lives of people who are marginalized. And I think people with intellectual disability, psychosocial disability, and other disabilities are amongst those who can very easily be administratively, professionally, in terms of our professional attitudes, and environmentally in terms of how society treats them, marginalized in terms of meeting their full potential and living quality lives. So this research prioritizes their needs and voices, and in doing so, we need to do so in an ethically sound and inclusive way, with the output then being impactful knowledge. And by what do I mean by impactful knowledge? It's about generating knowledge that is actually going to enable us to support people with intellectual disabilities and other disabilities to use evidence in raising their own voices to bring about change they want. But it's also to ensure that our research is meaningful in terms of bringing about social change. So social responsive research is about including the voices of the people that we research with the aim of producing research that can make a difference. And in defining these topics that we choose, we have to be asking ourselves critical questions throughout the process. You know, why are we producing this research? For our PhD, for our master's degree, for our CV, it's ad hominem promotion season at UCT. And for those of you who are thinking of putting in an application, you know, social responsiveness would be one element that you have to look at, and you would need to have done socially responsive research that is engaging with communities, being able to fill in that. So yes, it's there for many purposes, all of them valid, but can our research then also be meaningful for the people that we are conducting the research on? So who will benefit on it? Who will we include? Who will be excluded? And do they need to be excluded if it's about them? And then to ask ourselves questions about how can we maximize their inclusion. Speaking then about our research methods and the way in which we engage with people. So just quickly to look at some of the principles of socially responsive research. So this lecture is about social responsiveness, and I'll get to that. But I thought, let's first speak about socially responsive research. So as I've mentioned, it's research. So think about the research you're doing or you're planning to do and ask yourself these questions. Is my research responsive to the social needs? Is it socially relevant for people in the real world, dealing with real world social problems or injustices? In our sector, it's health inequities, it's discrimination, it's stigma, and then the various injustices that people experience. We spoke about the research having to be participatory. So how do we make it participatory if we just fly in, collect data, fly out? So in terms of yourself, where do you find yourself located? What are the questions that's coming up with the people you interact with? In our field, our focus area, intellectual disability and psychosocial disability, because at the specialist level, we are dealing with and working with people who may have intellectual disability, but also experience mental illness, which could result in psychosocial disability. We work with people who have intellectual disability and other multiple impacts, which can also be disabling. So where are you located and what are the questions you are asking about your work to improve it, or others are asking, and can that begin to form the agenda for change that you're going to be researching in a location that you are embedded in, so that you don't land up stressing yourself out because now you're busy with a bit of research over here, but you actually spend most of your time over there. What's happening over there where you are that could be responsive to, engender responsiveness from you in terms of your research focus. Then a second principle of engagement would be to be inclusive of people with, in our case, intellectual disability. You can see this applies to any disability or any socially responsive research, where the stakeholders you're going to be working with, be they parents, families, community members, all persons with intellectual disability themselves. Remember that you are actually not there to represent your own views, but to be a channel for people to have access through research to telling their stories, their difficulties, as well as what they perceive to be solutions to that. So it has to be done in a way that enables people to do that. And in the instance of people with intellectual disabilities who may have many communication challenges and other challenges, we've really had to think out of the box to try and engage them in a way that is fair to them and has a reasonable chance of representing their views in the outputs that we produce. This, of course, results in us having to be quite reflexive in terms of our engagement in the communities that we work with. Petrus mentioned community-based participatory research. And again, how are we positioned in that space we are in? Do we have power from a particular signifier that we carry with our personhood? Have we been defined in a particular race, as a particular race, or are we privileging ourselves in terms of language? What about gender issues? Looking at intersectional things that can impact on the power dynamic between you and the people that you're going to be engaging with. And I think a very crucial issue with people with intellectual disability is that by virtue of being neurotypical ourselves, we may have access to a whole lot more about what goes on in the world than persons with intellectual disability, which automatically privileges us in terms of knowledge power. And so we need to be constructing our research that takes account of that and brings in rigorous methods of checking our own biases, our own knowledge frames relative to the people that we are investigating or researching with. And then to enable the participation, that we need to be using appropriate methods. So I'll just look more closely at a couple of those issues. So with people with intellectual disability, to meaningfully engage them as partners is a relatively new thing. It's very new for us, but even internationally, I think it's only really begun to take shape in the public's research spaces. Although when you hear the work that people have been doing internationally in terms of engaging people with intellectual disability in their research, there are people that have quietly been doing this for 20, 30 years. I guess quietly because it's such hard work that you have to beaver away there to make sure that you are doing it in a way that, as I said, is fair. But I was at a conference, an IACID conference. That's one of the really big international bodies looking at research to practice for people with intellectual and developmental disabilities. I was at a conference in 2019, and because I have an interest in, I've always had an interest in including the voices of other people, marginalized people in my research, and focusing again after a long time on people with intellectual disability. I was drawn to the presentations that looked at how to include people with intellectual disability in my research going forward. And there was a very small group of people presenting on behalf of people with intellectual disability. There was one father and son who were working as a team there, presenting their co-constructed research. Fast forward to 2024, the IACID conference in Chicago last year, and what a change. There was a very large stream of inclusive research, co-presented very fairly and equitably by neurotypical researchers and their co-presenters, co-researchers with intellectual and developmental disability, panel discussions which were inclusive. So it was really lovely to see and to draw inspiration from the growing body of work in this area. For ourselves, starting off with this kind of work when I joined in 2018, I felt that for our local context, we really needed to conceptualize the work that we were going to be doing. And this year is the work of Babawa Tibashipume, one of our PhD students who completed in 2023. And her work focused on developing a conceptual framework for engaging people in self-advocacy, with self-advocacy being able to, the ability to speak up for yourself. And really in research, we're wanting people with intellectual disability to speak up for themselves. So she focused her PhD on speaking up for yourself as a person with intellectual disability in the service development and policy arena. which a lot of people thought. I remember when I did my PhD, I also focused on people with psychosocial disability. And a year and a half in, I've started to feel afraid, because a lot of people said to me, but why are you asking these mentally ill people? Surely they can't. And I thought, my God, I've chosen the wrong topic. But of course, my fears were allayed by the persons with psychosocial disability being able to really articulate as they should. And certainly also in the Bauer's study with adapted methods, we were able to really engage people to input to this conceptual framework. It's comprised of 3 sides, looking at the need to do, for personal development, for self-advocacy or speaking up for yourself, which is a common thing for all of us. I mean, I can't be sitting here doing this lecture without any development. So, to be able to do this, and certainly if we're going to expect people with ID to engage in this way, we must actually support them with appropriate training. In this instance, she engaged with people who had intellectual disability, but already had lived experience of working as self-advocates in their organizations. So they already were able to offer us rich information around how this might be done with others with ID who want to self-advocate in the realm of research, protest, engagements around policies, merely being government statements about how we should be supported to live our quality lives, and they are often left out of that. Then the second element is looking at supports for people with intellectual disability from various partners. And I just want to draw your attention to the fact that she used the philosophy of Ubuntu as one of her research frameworks. And we all know that Ubuntu speaks to human beings being who they are through others. I am who I am because of whom you are. So moving away from conceptualizing things on an individual basis, that lie that we tell ourselves about being independent. None of us are independent. We're all interlocked with other people and need their supports. And in the case of people with intellectual disability, perhaps they just need more obvious and more concentrated support than the average neurotypical person. So incorporating this concept, Bauer is speaking about framing research and practice and dissemination of research with people with intellectual disability from a perspective of interdependence. So when we're conducting research with them, bringing in supporters, using participatory methods, is acknowledging human need for interdependence, and in particular for people who may have more support needs than the average person. And then lastly, the conceptual framework speaks to the spirit of socially relevant research, which is that the outputs of our engagements must improve the quality of life of people with ID, and empower them, their own sense. They should be leaving your interviews, they should be leaving your research spaces feeling truly validated as people, particularly because of the fact that they are often not engaged with. So then looking at her second pillar, where she spoke about in the top there, empowering through self-advocacy, skills development, and the first column that speaks to the traits and abilities that we need to be supporting people with ID to participate. Cole Goldberg, PhD, looked at what practical strategies we could be using to include the voices of people with intellectual disability. Just as a point of interest, for Cole, and this was an issue of debate with, with one of her examiners, who couldn't understand why she was including an accessible toolkit for training. So she wrote a beautiful PhD from with an academic lens about how to develop, what strategies to use to promote inclusion. But then she went a step further and she developed a accessible toolkit which spoke to her research findings. And we were asked to take that out. So we thought it was important. But so just think about that link between what you are researching and the outputs that you produce. So her accessible toolkit is being used now by one of our leading NGOs working with intellectual disability. They're adapting it for training self-advocates in their space. Babawa's PhD is currently being used as a conceptual framework for a study being done at Stellenbosch University, developing outputs for self-advocates in the Special Olympics space. So making sure that your research can produce something tangible. So from Cole's presentation, she also looked at practical strategies that people with intellectual disability could use to self-advocate. The value for us as researchers was when it comes to disseminating our findings, of course, nothing about us without us. We find it very important to try as far as possible to include persons with intellectual disability in our dissemination process. So this has given us some, evidence-based options for disseminating our findings in a way that is possible to include people with intellectual disability. So public spaces, engaging through media and written words, social responsiveness in action. Sorry about that. And at the bottom, you will see that in doing this work, we would, of course, be having supporters being allies working with people with intellectual disability to enable them to do this participation. So, for example, one group of young people wanted to, you remember there was this young man, Mr. Juries, a young boy, I think he was 16, and he was shot by police for not, going into his house during COVID, and he was a person with intellectual disability. This group of young people at an education center for persons with intellectual disability was saddened and outraged by it and decided to write a letter to the press. They couldn't write the letter, but they could dictate the letter to their supporter and send that off. And there are other examples. So then in our research, we saw that participatory research takes a long time. Inclusive research requires people to be on board from the beginning. So, for example, you might have begun to write your research proposal, but have you consulted the people that you're writing about to see, are you on track? Are there adjustments that could be made to your research that would make it more meaningful to answer questions that they might answer? So right from the beginning, involving them in the design, in the methods, and then also reflections on your findings. So this makes it very difficult for the researcher who also has his, her, or their constraints to their research. A 3-year NRF grant makes it very hard to do this engaged research. Expectations, financial constraints from yourself. There are any number of factors that can make it hard for us to do this kind of research. So it takes a lot of careful thinking through, which is why I'm suggesting that if possible, you do your research in locations that you're already embedded in, so that in terms of knowing the communities that you're working with, you already have a head start, as opposed to flying in, doing pseudo participatory research and then flying out with findings that you haven't really worked with the community on, but yeah, so these are the kinds of things you would need to be thinking about. Co-developing your research, and then we saw that these are possibilities for co-presentation. One of my master students was just passed, and I shouldn't have had this conversation with her now. I said, okay, so now the paper that you promised you will write. Oh my God, do I have to write a paper? I said, we have to write a paper. And I said, how about the conference? Your findings are amazing. Let's present it. I don't think I can. I've got anxiety about presenting. So I said, but now tell me where you work. This is a person who's a social worker. I said, how about that local forum in the community? Can you go and do a presentation? We went through all the things she's already connected in, and which she can easily, as part of her work, disseminate her findings in. And so I think she felt a little bit more relieved at the end of the conversation. But I'm sure we'll get her at the conference eventually. But she must start where she's comfortable. Then appropriate methods. We're using quite a lot of visual methodologies, and photo voices things become a really good support to us as researchers in conducting our research, as well as being accessible to people with intellectual disability who obviously have good vision. So sometimes we are called to adapt our methods. So for example, Santiswa Mashalogo, who is a speech and language therapist, who wanted to look at the views of deaf persons with intellectual disability and their parents on speech and language services they've received, had to adapt her work, bringing in and training a sign language interpreter. And then because all of the information was in sign language, we use video recordings instead of taped methods. Sibesihle Silazi, whose work you can see pictured on the other side of the screen. She did a master's looking at getting the views of people with intellectual disability on their priorities in life, which they think that government should be looking at. She had intended doing face-to-face photo voice, but there were constraints, which meant she had to rework her protocol, reapply for ethics approval. It took her another 6 months to be able to interview her participants online with supporters, having gone through very careful revisions of her work so that it would be appropriate. And you can see here one of her participants, Precious, spoke about her views on the inadequacies of hospital infrastructure and access in her way of presenting it. Those are our own words there, not academic, but certainly reframable for the spaces that policymakers and service providers and planners can understand. And then a final example here is of appropriate methods is the use of easy to read documents. I had shown you Babawa's conceptual framework. When she went back to check in with her participants for people with intellectual disability, she converted that framework into an easy to read document. This is a piece of it. And if you could read it, you would see that it starts off with, just reframing what has already taken place, what has already been agreed on in previous interviews, as a prelude to moving into the next phase of checking in whether she had correctly and appropriately captured their views. So we're also moving more and more to using easy to read. It's quite expensive, so I've just completed the easy to read course. I can write my own easy to read documents. But first I must hand in my assignment to see if I pass. So, in lectures like this, one can make it look easy, but there's always things to be learning and you always make mistakes. And I just wanted to share this with everyone, lessons we learned from a project we did where we had an advisory committee, which included people with intellectual disability. And quite a few lessons, that it was important to include them. They did make really meaningful contributions, particularly in the meetings where we had separate engagements with them. But we found that when we brought them into the actual advisory committee meetings, where there were also other neurotypical professionals in the disability movement, that it indicated to us that we actually needed to do way more work than we did do. Because, for example, the disability researchers and practitioners struggle to communicate their views in non-technical language. When we get into that frame, we use our jargon, and they were not accustomed to thinking on their feet about how to say this in a way that was accessible. The self-advocates were able to express their view in plain language during prep sessions, but in terms of meeting in this advisory committee, I think they were in awe of the professionals, and it made it difficult for them to express themselves. So that power dynamic, more time perhaps should have been spent, for the people to get to know each other from both sides. So sometimes we think the constraint is in the person with the disability, but it also can be in ourselves. We did prep meetings in person, but COVID was happening at the time, and the distance, and besides that, the distance of the other people on the panel resulted in us in actually having the meetings online. So although these people were familiar with online work in their own space, I think that added a layer of difficulty in the communication between the neurotypical people and their jargon, and these ordinary citizens who had their views but didn't have the jargon and were silenced by the power structures in the meeting, exacerbated by being online. And then time set aside to develop the accessible materials and schedule prep meetings, I felt was insufficient. So what did we learn from that? Hang on, what am I doing here now? Let me keep this thing out the way. What we learned was that we don't only need to train the persons with intellectual disability, we also need to look at the needs of the researchers in terms of being able to engage in those spaces. Adequate advisor training and provision of time in the research timeline to prepare research materials. I think I've learned that make it longer than you think you need. And then training for supporters, although we had supporters in meetings who had a lot of experience working with intellectual disability, persons with ID, they didn't have a lot of experience around being a supporter in a research context. So again, another element that we need to be thinking of, trying to recognize and action the impact of these power differences. And then, a practical thing was that I felt it inappropriate to pay the professionals in the room one rate and the advisors with ID another rate. So I paid them all the same, but practically the advisors with ID were not accustomed to managing money like that. So we needed to have thought about training them to manage their money. And yes, a lot of practical issues came up. But these are the things that happen in the research. I think I try to warn all my students that we've got this beautiful research proposal, but let's see what happens, because things come up in research that's involving people on the ground that will result in you have to be quite flexible. So we already mentioned 4 principles of socially responsive research. The last 2 I've left for now because I want to take us back to the issue of social responsiveness. And you'll see there that the last 2 principles is commitment to social change, where you're really aiming to change services, empower communities, and that you want to be making sure that your work is accessible both to academic audiences and non-academic audiences, and then the need to actually take co-responsibility for capacity building, the development of practical tools to enhance your co-researchers, your advisors, or your participants' meaningful contribution to the research. So I mentioned at the beginning that it's add-on season year, and for those who are working in as lecturers or researchers or joint appointees in an academic space, just to remind you that socially responsive research, which we spoke about now, also supports social responsiveness. If you are doing it in that way, it will automatically enable you to build your social responsiveness profile. So what is social responsiveness then? It's any form of engaged scholarship that you might undertake with external non-academic constituencies, and you will remember that the people I've mentioned before in the presentations are those people. What is engaged scholarship? It's you using your academic work and your professional experience with an intentional public purpose to benefit those external non-academic constituencies. So for your research to be impactful, it's also important that you link with and find your space in NGOs, communities who can take your research and repurpose it or use it as evidence for the work they are doing in those communities. So it's a reciprocal relationship. We also have researchers in our department who may not be, health professionals. They might not have that professional lens from a health worker point of view, but you could still partner with health workers because our researchers in our department also have exceptional expertise in the task of research. So to get support for yourselves, working together like that could also increase both parties' social responsiveness profile. And there's a wide span of activities that fall under this engaged scholarship. If you look in the add-on criteria, they list 5 different kinds of spaces that you could be implementing, bringing your professional expertise and research outputs to, and they are professional service provision, community outreach, policy and legislative input, public sector and service systems development, and then public information and promotion and participation. So what are these? Just in summary, this is my second last slide. I'm at the end of time. Good. So professional services, though, that is, your direct practical services in a professional setting beyond your university or academic base, and evidence-based professional contributions and expertise. So, for example, you might have an organization that is starting a learning center for people with intellectual disability, and you might have expertise as a educational psychologist who has worked in that field, and you would be bringing your research and your professional expertise to that community-based task in a consultative way. For example, community outreach. So we do community outreach as clinicians in our jobs, where we are, going into the districts and working there. But in this sense, I'm talking about community outreach, where you are at a local, national, or international level, engaging with constituencies outside of your immediate clinical space to assist them in developing interventions, implementing interventions in an appropriate way. And I mean, there are many settings that we can find ourselves in. When I say local, national, and international, I thought, okay, gosh, now people don't think is that all about just like ordinary structures, schools. I know Fatima here next to me does an incredible amount of community outreach for schools, NGOs, etc., bringing a professional expertise as well as her experience as a person who has extensive experience working with people with intellectual disability. And I'm sure there are among you the already having that, but, you know, not having as yet thought about or made deliberate spaces in your schedule to share your expertise in this social responsive way. Then the third area is policy input and advocacy, policy reform. And you will have seen in the examples of the research that I've mentioned that my students are undertaking, that is a space that we are trying to contribute to. So, you know, we would do things like make sure we're keeping our eye on when new legislation is coming out, guidelines are coming out, policies are coming out, and actively providing input to those processes to ensure that they include research findings about people with intellectual disability applied in that policy and service development context. And you would have your own focus, child and adolescent forensic. There might be, you know, where you could be keeping your eye, but you have to actually keep your eye out for these policies. You have to tag yourself to the parliamentary monitoring group, for example, so you get alerts, so you know what's happening out there. You can do this also through the NGOs that you engage with, who might be faster on the keep track of events, things, and could then ask you to contribute in that way. Public services and systems development, volunteering to be on committees, in-house committees where you bring your expertise, as well as other spaces. For example, with the NHI now, there's all those working groups that are being set up, advisory groups that have been set up to develop packages of care that's going to be, you know, included in the benefits package. I spoke to a colleague who's been invited to serve on the equipments committee, where they, in his instance, he's contributing to look at the set of approved psychological and psychometric tests. So I said to him, oh, and how many are there for people with intellectual disabilities? He said, oh, I'm not sure, but I'll get back to you once the committee meets. So use every opportunity to, you know, input to these external spaces and initiatives that have an impact using your research and professional expertise. And then lastly, writing accessible opinion pieces, editorials, etc., and trying in all instances to showcase people with intellectual disabilities' views themselves. Because I always find that, I mean, I can talk till I'm blue, but if I have a person with intellectual disability in that space, it has so much more impact than I could ever have. And that is correct, because the first person accounts, which you try to locate in your research, must also find its way onto the public platform. And we can facilitate that access and should do so. Coming back to that slide that I showed you, where there are so many spaces where we could be doing this public discourse with people with intellectual disability, psychosocial disability, children and adolescents, etc., and you should use those opportunities. So I just want to thank you for your attention, and also just to remind people who is in our division, some of whom are staff members engaging in research, others are co-supervising or supervising our student projects, or being involved in our dissemination in efforts through our annual talks and seminars. We also have Sia Kabele and Helena Thornton, who are not in our division but co-supervising work, and we're grateful to them. And then just to acknowledge the names of the students' work that I have presented to you: Babawa, Maxine Cole, Santiswa Nati, and CBC Schleff. Thanks so much.
Thanks you, Sharon. Okay. So I think that was very insightful. And I'm looking just at time, and I want to give some space for any questions. I want to just quickly say that, Sharon, thank you so much. You've emphasized really that socially responsive research with and for people with intellectual disability emphasizes ethical, inclusive, participatory research and approaches and accessibility that value the voices and experience of people with intellectual disabilities as central to the research process.
Absolutely.
And I think that with that, we're using people with intellectual disability as co-advisors and researchers, all right, as part of the process. And I think that one thing that I was asking myself, and I would like to ask the audience as well is, we need to ask ourselves, do people with intellectual disability need to speak or write academically to be able to be seen as a researcher? And oftentimes we also need to look at how many of us has actually included people with intellectual disability in creating the questions for the research already from the onset of the process of research, rather than towards the middle and end. And I think that's very important to highlight. I want to take, some questions, and I see that there's nothing in the chat, but I'd like to encourage participants. You're welcome to put on your camera and ask Sharon a question directly, for any of us. And please, I'd like to encourage you to ask the complex questions. It's not easy. And as Sharon has indicated, that we've had lessons learned as well. We don't know how it's going to turn out, and we're okay to learn from trial and error with those lessons, as long as we are communicating and collaborating. I think that's what's important. Oftentimes we find that there is an avoidance due to unintentional ignorance about how to work with people with intellectual disabilities. And I think that, Sharon, you've given us quite a great insight into a user-friendly tool for self-advocacy, and also the accessibility toolkit for training, which I think has been quite a practical toolkit that one can use. So I'd like to ask participants, Petrus, I see you on. Go ahead.
I'm pausing and waiting for other people, but otherwise I'm going to jump in.
Jump in.
Thank you, Sharon, for a perfect